Good evening. It is May 18th, 2021. I'd like to call the Canton Township of Canton Board meeting to order. Clerk Seegers, can you please take roll call?
Warinsky.
And state where you are, sorry.
And say where we are.
Yes.
I am here at my home in Canton Township.
Foster.
Good evening from my home in Canton Township.
Ganguly.
Good evening. I'm here in my home in Canton Township.
Graham Hudek.
Good evening. I'm here at the Canton Township Hall.
Segrist is present and in Canton. Slavens.
Sorry about that. Good evening from Canton Township.
And Snyderman.
Hello, today I'm in Gladwin, Michigan.
Oh, great, thank you. So I would like to hear a motion to adopt the agenda with an addition of a discussion on the new mask mandate right after the general calendar and just before the study session.
So moved.
Support.
Please take roll call on the motion, Michael.
Warinsky.
Aye.
Foster.
Aye.
Ganguly.
Aye.
Graham Hudek.
Aye.
Segrist, aye. Slavens.
Aye.
And Snyderman.
Aye.
Great, thank you. So the agenda is adopted. Now, the next item is general calendar. Can I have a motion to consider approval of lawn maintenance contract for 2021 through 2025?
I don't have my board packet in front of me. Would somebody else be willing to read the motion?
Kate, go ahead.
Helps if I unmute, doesn't it?
Mm-hmm.
So I move to award the 2021 through 2025 lawn maintenance contract to Reliable Landscaping, 8285 Lily Road, Canton, Michigan, and the funds are to be paid out of the accounts listed on the RBA.
Support.
Thank you. This item was tabled last week to come to the board this week. On March 4th, 2021, an RFP request for proposal was advertised for the mowing and lawn care maintenance of select township maintained properties. Top 3 qualified companies were contacted and interviewed by a selection panel consisting of leisure services and finance staff who scored each company based on a set criterion detailed in the RFP. As a result, we are recommending to award a 4-year contract to Reliable Landscaping Incorporated for the mowing and lawn care maintenance of select township properties for a total amount not to exceed $49,900 per year, which includes a $2,500 contingency. Director Holmberger, do you have anything to add?
Nothing further to add. Just happy to answer any questions if anybody has any.
We did supply the board with information requested at the last meeting. Are there any questions or comments from the board? Okay.
Yes, I just wanted to thank Director Hohenberger and his staff for giving us that additional information that we requested. It really helped us make, a better decision and do our due diligence. So thank you.
Thank you. Anyone else?
No, I would just echo Trustee Borninski's sentiments and just say that, going forward, I think, as long as we find a process that works, that we're all comfortable with, we can use those bid review committees, provided there's board input or board, something a little bit like this.
All right, thank you. Anyone else on the board? Great, yes, thank you. Thank you very much. Thanks, Greg. Clerk Seegers, can you please take a roll call on the motion?
Borninski.
Aye.
Foster.
Aye.
Ganguly.
Aye.
Graham Hudek.
Aye.
Segrist, aye. Slavens.
Aye.
Snyderman.
Aye.
Motion passes. The next item is the change that we made in the agenda to discuss the mask discussion. As we know, we did have a vaccination site, a COVID vaccination site, which its last day was last Tuesday. And the reason is because we saw no need to further provide a vaccination site, as most residents have been able to walk into wherever they are able to right now. On Friday, we were told about a new order from MDHSS regarding masks and requiring people who were not vaccinated to wear masks versus those who were vaccinated. We made a decision on Friday to keep our mask mandate in our facilities, including our administration building and our leisure services summit, until we were able to have a discussion today. So I just want to let you know, the staff discussed today and made the following recommendation. And Corrine is online to answer any questions about MIOSHA. So MIOSHA, basically, and I'll have her explain this a little bit, but the staff recommended that in following MIOSHA, the residents keep masks on in our individual facilities until MIOSHA allows employees to not wear masks. Corrine, would you explain the MIOSHA rules a little bit around masks and our employees?
Sure. So there's 3 agencies we're working with. We have the CDC guidelines, we have the MDHHS order, which came out on Friday, and then we have MIOSHA, which really regulates the employer's obligations for safety and health and safety of their employees. So unfortunately, they're behind in issuing what their guidelines are going to be as to how we actually proceed with that. In the last conversations I had, we could get those guidelines as early as tomorrow, but until they have issued those, we really don't know what they're going to look like. What they have said on the website, at least their only indication to us, is that if, say, an employee filed a complaint against the township because somebody who was vaccinated was not wearing their mask, they would view that to be in compliance with the MDHHS guidelines, even though from an enforcement standpoint. So they would not come back on the employer in that case, basically, because they're making a good faith effort to comply with the guideline, the order that came out on Friday, but MIOSHA hasn't updated their guidelines yet.
So in the meeting today, as Corrine explained with the guidelines, is our employees are being required to wear masks at work to keep themselves safe. And because residents coming into our facilities, whether it be at the summit or in the administration building or the police station, are also required to wear masks because we are trying to keep our employees safe. So that is a recommendation of the staff. Does anyone have any questions or comments around that? Any board members or staff members? Does anyone have any issue? Okay, go ahead.
So the MIOSHA guidelines sort of set the minimum level that we need to do. Is it possible for employers to do more than what the MIOSHA guidelines say we need to do?
If the township chose to continue enforcing wearing masks in our facilities to protect our employees, we have the ability to do that.
Okay, thank you.
Any other questions? Stephen?
Okay, yeah, thank you. Madam Supervisor, do we yet have the ability to know percentage of the residents in Canton that have been vaccinated?
We don't, and it sounds like we had made a request again of Wayne County last week. It sounds like it's going to take some time. They're trying to set up a software program to merge census tract data with vaccination data to give that report. Right now, we know that Wayne County without the city of Detroit is approximately 44% vaccinated. The city of Detroit is about 25% vaccinated, but we don't know on a community level. Although Canton is always in the top 3% because of our population also in terms of infection rates. We're at about, I think we're at 7% of Wayne County. They're estimating that are vaccinated. I'm sorry, that are coming up with COVID positive testing.
7% of Wayne County's positives are in Canton?
Correct.
That's what that means, okay. Okay. Yeah, I mean, I'm fine with following the recommendation. I would just like to see maybe some kind of plan that says once we know what percentage vaccinated we are and when an infection rate gets down to a certain level, that we'll choose to start relaxing these things so the community can understand and know what to expect.
Correct. Actually, all the cities and townships have been asking for that data. So we know where to also actually concentrate our efforts on getting more people vaccinated also.
Yeah. So like if you said when the infection rate goes down to, 1% or some targets, if we can develop some targets that we know will open up the buildings to certain levels of relaxing the mask guidelines and other guidelines that we have.
Okay, one thing, remember too, there are, as we know, as we saw in our vaccination sites, vaccination rates have declined rapidly. So there will be a point where we might not get to it. That's one concern. Okay.
So I just want to be clear on what we're discussing. And my understanding is that MIOSHA is possibly going to be following the CDC recommendation, which is that people who are vaccinated do not need to wear masks, but those who are unvaccinated do need to still wear masks. Is that kind of summing it up correctly, or?
Is that correct, Corinne?
As far as we know, we expect that they will follow the MDHHS guidelines that came out on Friday, but they're not always exact. So it could come with greater guidance or some indication as to how the employer is required to do that.
Okay, yeah, so my concern is that how do we know who's vaccinated and who's not, and any kind of burden that might be on our employees and our staff to try to understand that.
We can't ask people if they're vaccinated. I mean, I guess we could, but in terms of them having to prove it, we couldn't have that proof. We can't enforce that. So it would have to be on the honor system as it is in the rest of the community.
And if I could intervene too, right now, staff's wearing masks, residents coming in are wearing masks, and we have the sneeze guards up, and then hand sanitizers in the building. The only change that could happen is if MIOSHA relaxes the mask rule. And then at that point, I guess the question is, do we feel comfortable enough allowing residents to come into the building without a mask on? And do we feel, if the MIOSHA rules lifted, do we feel comfortable with our staff not wearing masks as well? Staff's all spaced far apart, 3 to 6 feet, but there are times where they're walking in the hall or, sitting at a table, having lunch together. So these are some of the questions, we've got to, I assume, that are up for debate or what have you.
And we do have employees working from home also. We allow that also. Tanya?
Yeah. So there is, as Corinne said, there is a thing, high probability that MIOSHA will recommend some sort of guidelines by this week, and it will match what the MDHHS requested. So that means we have to follow an honor system of wearing masks. We have to trust people, and that gives me a concern for our employees. If even if they are vaccinated, and some want to be careful, some are okay with the system, and they might. I'm concerned for the safety of the employees, and as I also want to further emphasize on what Stephen said, having some kind of metrics on where we can, even if we have some sort of a mask mandate on top of what MIOSHA is suggesting, we have a metrics in place. Like at this point, we are going to say that you don't have to wear a mask But my concern is the safety of our employees. And since Canton is still on the top 7% of the infection rates, so that is my biggest concern about keeping our employees safe, whether it be the summit or the treasurer's office, the clerk's office, anybody who comes face to face, or even in the interaction within the offices. So people might have different preferences. So we as a board probably have to come with some sort of a guideline. I understand that's what we have to do it today. Do we have to finalize it today? If Mayusha changes things by tomorrow and there is, like we are saying, we will use the honor system, I am not comfortable with putting our employees at risk.
Okay, anyone else? Summer?
So I'll just say I'm comfortable with following the employee's recommendation. I recognize that I will not be in the township offices every day dealing with the public, and they will. So I would be comfortable following their recommendation on this. I did have a conversation with the library director today to see what the library was doing, and she said that it's coming up before her board on Thursday, but as of now, they are following the MIOSHA recommendation. And I got an email from the school district, Plymouth Canton School District today, and they are enforcing masks within their buildings until the end of the school year. And so I do think some consistency within the community is a good idea also.
So are you suggesting that we do it until a certain date, Summer, or what do you suggest?
So I'm comfortable with following the employee's recommendation I do like what Stephen suggested to see if there are certain metrics that we want to go with, but I'm comfortable with what they want to do.
Okay, and I know that yes, so that's a good idea. We've been asking though for metrics, and until we get it, all we have is Wayne County metrics, and it's hard to determine, our community amongst that. But as soon as we get the metrics, I agree, we can put those up. Kate?
Yeah, so I agree with a lot of what's been said. I just want to understand better when you say that it's a staff recommendation, who gave input into that?
So every week we have a weekly staff meeting with directors and some of the managers, and that's where it came from. And then Corrine was here and we talked about the MIOSHA regulations at the time.
Okay, so it wasn't like, all staff. It was
No.
the administration basically.
Right.
Okay.
Right.
Do you know, and I know there's a few directors on this Zoom, just wondering if they got input from their employees on this or not.
Jade?
I didn't get any direct input, but I can tell you that it wasn't even a discussion actually, and everybody was continuing to wear their masks today. So I think that it's business as it has been until we direct otherwise. And I think people are very comfortable wearing their masks when they're in the common areas, except when they're at their desk or in their office. So I saw business as normal today without any questions.
Greg?
Yeah, I would say as far as my staff goes, they're very comfortable with wearing a mask. Their only hesitation as far as requiring guests for wearing masks is a lot of times our facilities, Summit, Pheasant Run, Sports Center, Village Cedar, et cetera, are run on the weekends, evenings, off times where it's just part-time staff. And we already have a lot of those staff to enforce a lot of rules, and this is just one more rule. But I think especially until we get more clarification from the MDHHS and MIOSHA on what we can and can't ask, any capacity changes, there's a litany of questions that I think all of us have that I feel comfortable that at least until we get that further guidance, that we should continue with requiring masks and then go from there. But it's kind of the only input I received from staff was any potential pushback we have from the public.
Chad, did you hear anything? Although you guys are under different circumstances.
It's a little bit different. Our employees been working through it for a long time. I know there's if you watch any of our police, they're pretty positioned to have their mask off when they're outside. Mostly, we just need to follow the guidelines as they are right now and see what this, from my perspective, and see what the state does in the next few days.
Okay. Corinne, have you heard anything?
We did not hear anything from the employees. Our employees continued business as usual. And we didn't get phone calls related to it today. So, or even yesterday. I would have expected that if there were people who were concerned about it.
Okay. So is everyone in agreement then? We can take a vote here, or we can just stay as we are right now in terms of following my OSHA guidelines until we hear differently, and we can reevaluate at that time.
So just so I can clarify, so we're following my OSHA guidelines for the staff, which I think we're legally required to, but we're also having the community follow that. So as long as the employees are masked, individuals who interact with township facilities will be masked as well. But if the MIOSHA guidelines change and staff no longer is required to wear a mask if they are vaccinated, that we would extend that exact same, we would then adopt that. That's the policy we would use internally for our staff, and the policy we would have externally for residents that interact with township facilities. Is that the appropriate summation of kind of the official position that was brought forward and that we've kind of discussed?
Yes, so that would mean that we would post on our doors exactly what you said, that if you are unvaccinated, you're required to wear a mask in our facilities.
And it's self-enforcing. And we're not concerned with all the stuff that Stephen was talking about. We're not concerned about vaccination rates. We're not concerned about infection rates, deaths, or hospitalizations. None of that stuff will really matter. The trigger for removing the requirement that everybody wear a mask is once MIOSHA says go, then we go. Okay.
That's not what I heard.
No.
Greg?
Yeah, just to clarify, I think what we were saying was that if and when MIOSHA and MDHHS make a change that would allow employees to go unmasked, that we would then reconsider, but not necessarily make a change, but at least come up with maybe a new recommendation and then have further discussion with the board before we make any changes.
Okay, thanks. Tanya, did you have your hand up?
Yeah, so if so, we will keep whatever is the current MIOSHA recommendations till even if it changes midweek this week, we will have to wait for a future discussion, probably in the next board meeting, to come to a decision then.
Yes. Is everyone okay? And we'll keep pushing for data like we have been. Strongly.
That's my understanding as well.
Okay.
Yeah, I'm comfortable with keeping the current MIOSHA guidelines in place until we hear further from MIOSHA and MDHHS and have a further discussion.
So basically, we're keeping the requirement for masks for employees and visitors until MIOSHA changes. And when MIOSHA changes, we will have administration will meet again and have a recommendation to bring to the next available board meeting.
Sounds like what everybody's comfortable with. Okay. And Maybe we'll get some data before then, but right now we only have countywide. Okay. Is everyone okay? Diane?
Yeah, I just want to say real quick, it is very difficult to get data. And so for the metrics, we're going to have to, if we don't get that data, we're going to have to find a different way of metrics, because
Right.
I don't know how, we can measure it if Wayne County's not giving us the data. So
Right,
something to think about.
right. Okay. Does the board want to make a motion and take a vote, or are we all okay with the way it is as stated?
And so the vote would be to continue the mask requirement?
Right, until my OSHA changes and we meet it and we get another recommendation from staff and then meet again.
I mean, I'm comfortable with you just moving forward exactly how we've been doing it. And then if we decide it's worth revisiting, we revisit it.
Okay,
I don't know if that requires a vote.
all right.
I'm good.
I'm good.
I'm good with that.
Diane, okay.
Yeah, I'm fine. Do you want to vote on it or no?
No, or I'm okay. Everyone's okay. All right, great, thank you. The next item on the agenda is a study session led by Chad Bow, data transparency, crime, diversion training, and special topics. Is there anyone else that you want elevated? I see Lauren on. I don't know if you can see Chad.
Yeah, I think we have everyone. You might want to elevate Lauren. She always has good insight. Maybe at some point she could offer some insight if she wanted to.
Okay, great, thank you. So I think you can go ahead and share if you'd like.
Yeah. Make sure. Can you see my screen?
Yes.
All right. Well, thanks everyone. You asked for data. It's not the data you're looking for maybe as it relates to COVID, but we brought 68 slides to go through today. I have a good number of people here, and what we'll do is try to introduce and hopefully be a little bit interactive, because a lot of this is board driven, trying to find out information about the police department. And that's what we're trying to do today, is to work with our citizens, and you represent the citizens, about how we program our police department. And it's linked to the objectives of the township, which are, there's three of the objectives directly, which is a welcoming community, the organizational climate and culture, and quality infrastructure. When you talk about infrastructure, you may see, and Megan may be able to address this too when she gets to speak, but the amount of steps that she has to go to with what I would term as an archaic RMS system. While we think it's the best one out there for police, it is not like what you would expect in the private sector. So some of our partners here today, besides Megan, who's our crime analyst, is the deputy chief, and he'll speak and interject, and we'll go back and forth as we discuss all this different data. And real important, we have GrowthWorks here, and they'll be able to speak about our CMO with them, or what they provide for us, which is for adjudicated youth, and we'll have information about juvenile diversion, and they'll speak a little bit about Wayne Rescue Recovery. So with that, it's Nick Griswold, Jennifer Seibel, and Tiffany Brochard. So with police programming, now, and I'll keep the scope of this real light, but provides a little bit of context going into our data, which is we're real focused and we're clear-eyed and unwavering commitment to further our community engagement and inclusion to our services. We're trying to do that with our stats. You know, our program is both visionary and effective. We try to be humble most of the time, but this second bullet point, we're not so much. We are a visionary. You know, you talk about leading and driving the bus. Sometimes we're even manufacturing the bus, and we're proud of that. And it's built on training and oversight. You know, through this process, and I've learned here in the last year, we're making the next progressions of policing. We're anticipating challenging the norms of traditional models. Specifically, is we define items like accountability. When you look at accountability, traditional policing is the day is done when you put someone in jail. We're trying to challenge some of those concepts and redefine accountability in a legal way that meets what the township residents wants from us. You know, when you look at our police department, we have uniform services, support services, and investigative services. They all come together We have a constitutional and holistic model of policing to address our police program, and we're finding progressive solutions and alternate ways of programming for our police department to engage our citizens, and by engaging our citizens in the process. So here we are with data transparency. Megan does a lot for us. She's a crime analyst, but she's also essentially a performance analyst too. She looks at how we perform. She looks at how we perform in patrol and investigations, and we're going to dive into some of the data that's been requested. Here's a table of contents. We're going to talk about crime, calls for service, arrests, citations, juvenile diversion, and kind of hit on family trouble and civil matter investigations in alternate ways. So when you look at crime, I'm going to turn this over to Megan right now. Megan, because of we were set up, I'll run the slides and I'll be able to time it pretty well, I believe. So
Okay.
if you would, just if you could cover this part of this and explain what Part 1 crimes are.
So Part 1 crimes are defined by the FBI. They do violent crimes and property crimes. It's just a different way of recording it so that everyone across the United States records it the same. So the violent crimes are things like CSCs, which are sexual assaults, criminal sexual assaults, robberies, and felonious assaults, just an assault that's a felony. And then all in blue are the property crimes. So you have arson, burglary, which includes home invasions, larcenies, whether it be from an automobile, a building, or a person, motor vehicle theft, and retail fraud. And so we'll separate those out. Go ahead.
All right, now with this, the crime that follows this up, you'll see that our violent crimes are up 18% and our property crimes are down 20%. We had a major hit to crime, which was helpful for us at 17.2% last year at 2020, mostly because of the epidemic. So we're looking at calls for service right now, and we're trending back up. You'll see in a slide here shortly, we're up 25%. I'll let Megan explain that, but we were down 25% last year, but we're trending back up right now at about 13% for total calls for service. Now, Megan, if you could explain violent crimes, you can.
Sure. So if you look at the violent crimes graph there, it goes down for a couple years and then it levels out. They usually average about like 680, 690. We had 2 really good years in 16 and 17. Our violent crimes went up a lot in 2020. And a lot of that's because of the aggravated assaults. So the aggravated assaults went up 36%. A lot of that's because of the pandemic and people being at home. All of the crimes that would happen in public areas like shopping malls or traffic crashes aren't happening as much. And things that happen at home like assaults, domestic violence, those type of things increased during that time. Yep, go ahead. And property,
go ahead.
Go ahead. No, please.
With property crimes, you'll see how it's decreased, and that lends to what Megan's about to say. Yeah.
So if you look at the property crimes, they all decreased about 20% from 2019 to 2020, which is great. Especially though, because of the larcenies from automobiles and retail frauds. And again, a lot of people being at home and not being out on the road leads to a decrease in opportunity for things like retail fraud and larceny.
We also seen with retail fraud, which is an issue for Canton Township traditionally, the actual employees working that type of issue, and the stores weren't employed, and the stores weren't necessarily open and working and operating as normal. I'm turning over calls for service to Megan too. She'll be able to explain a lot of this.
So calls for service have been trending up every year from 2016 to 2019. It was still trending up in 2020 all the way until the pandemic hit, and then the numbers decreased significantly. Again, obviously people are at home, they're not driving as much, they're not requesting as much police assistance for things. So our calls for service decreased by about 25% from 19 to 20. And that it's right in line with the pandemic.
And for 2021, we're seeing an increase about 13% for the year. Is that correct, Megan?
Yeah, it sounds right.
And if you could explain the time spent on calls for service.
Sure. So there are two parts. So this one is, if we take into consideration the total time that a call for service starts when it's created in the system, all the way to when they get there, then they finish the run all the way to the end. If we look at like the total time it takes for that and the amount that they have in a year, the most things, or what they spend the most time on, are traffic stops, suspicious persons, fire department, and I could read the list here, but these are all the things that they spend the most time on. Each one individually isn't necessarily a long time, but because there are so many of them, so many incidents, that's what they spend a majority of the time on. These are the incidents that, once the officers are out there, actually take a long time. So there may be few of them throughout the year, but they're time consuming for the officers to handle. So you'll see things like arson, robbery, burglaries, unattended deaths, things that need more investigation.
We're going to jump into arrests and offense, and obviously we'll take questions afterwards. I'm sure there might develop some questions along the way. But there's a definite difference, especially for a crime analyst, when she's jumping into our records management system and understanding the difference between arrests and offenses. And if you would, Megan.
Sure. So an arrest is what we're counting as when a person's actually physically arrested. So if I were arrested for 2 different calls for service on the same day, I'm counting it as 1 arrest. Now, if it's on 2 different days, now I'm 2 arrests. With that, with every arrest, there could be 1 or more offenses. So if I'm arrested for driving on a suspended license and also have a concealed pistol that I shouldn't, now that's 2 offenses. So I have to look at both the number of arrests and the number of offenses separately. So this is the demographics for arrestees in Canton by each year. So for the last 5 years. And at the bottom, I added to this slide the demographics for all of the townships that, or the top 5 places where people live. How do I explain that? The top 5 places our arrestees live. So Canton Township represents about 1/3 of our arrests. Then Detroit, Ypsilanti, Westland, and I added Wayne County because that was one of the requested groups as well.
And
Are there questions on how to read this?
well, I think I might be able to jump ahead on one question. We identify the location of the residents by what they provide at time of arrest, not necessarily what's on their Secretary of State license, if they have one.
Yeah, so when people are arrested and they're booked into the system, we ask them what their address is, what's the best address for you, where do you live, as opposed to what's on their license, because that's not always correct.
Okay, thanks.
If we look at demographics by age, sex, and race, you can see most of the people, or at least half of the people, are between 19 and 31, and the other half are spread out through the other age groups. About 4% were under 17 years old or juvenile, 17 and under. 3% represented are older, 60 and up.
It's essentially the same slide.
And again, the home city are where they live.
This is an interesting stat too, because of recent legislation, I think we're going to see this change a little bit. The number of people that become suspended because of some type of court issue will decrease, which will also have FTAs or fail to appear warrants and misdemeanor arrest warrants will become less likely as they had been in the past. And that was a common reason for arrest for the Canton Police Department. And we were real strict about how we approached this over the years. And it changed in March of last year. So it was because of the COVID-19, we kind of implemented a lot of things that came along here recently in April. But you will see an impact in our service needs in the booking room. We used to hover around 4,000 arrests a year, and I believe, is my suggestion, will probably be around 2,000 arrests a year. After not only how we handle business, number one, and number two is the different legislation that's went through. Nice. I believe I sent some of that out with the updates. Do you have anything on this, Megan?
No.
If you could explain some of the citation numbers that you have here.
Sure. So similar to arrests and offenses, we have citations and violations. So for every citation, which is just a ticket, you'll have one or more violations. So I could be given a citation for running a red light and having an improper plate and no insurance. So that citation, as an example, would count as 3 violations. So I put them on here separately so you can see.
Continue.
Here again, we have the citation demographics by race and sex for the last 5 years. And at the bottom, I again have Canton Township, Detroit, Ypsilanti, and Westland demographic breakdowns for comparison. Again, these are just the top 10 violations that we've had over the last 5 years. That's 2016 through 2020.
All right, we're going to head into juvenile diversion, and part of Megan's job is also to track this, and the stats and the information that she tracks for us is used as required. We update the Wayne County Prosecutor's Office of those that are involved in our juvenile diversion program, but it's also essential as we work back and forth with our program manager, the sergeant of our detective bureau right now with GrowthWorks, who we will transfer the mic to here shortly as we go through this PowerPoint.
Ed, can you see if we have any questions first on the first half?
Yeah,
sure. Diversion?
Yeah, go ahead. I don't know if I'll be able to see them, so if you could just.
Sure, I'll help you.
Okay.
Any questions or comments on some of the data that you've seen, or you want to look at it again? Kate?
Yeah, I just wanted to thank Chad for including the demographic information. I think that's really important for us to be able to see.
Yeah, I think in the future, hopefully the near future, we'll talk to the supervisor about this, is enlisting a university to understand who's actually here all the time, not just the residents. It'll help us understand how we do our job if we understand the demographics that are actually here, our daytime population. I don't know how to do that, accomplish that besides using someone from the university. So we've talked about it for years. So it's something I'd like to see in the next year or so.
Anyone else? We're also looking at, we do have a chart online on our website. And so if anyone has any comments as to what they'd like to see or change about it, just let us know. But also, Chad, if you could answer, I know we had talked about this the other day, in terms of when a ticket is written or citation is written, how you determine the race. Because as we know, the census lumps a lot of people together under white, which is not necessarily, we have a very diverse community. So how can we get a little bit more granular data?
Well, right now we determine the race by officer observation. And years ago, we've progressed a lot with that, with training. There's only certain categories allowed in the RMS system from CLMUS. And Megan, can you read white, black, Asian,
Indian. They don't have a non-Hispanic white. They group us all together.
Right. So there's a lot of struggles with that. As the chiefs come together, they're trying to make additions to provide more categories to capture those that we're having contact with citations. In really Dearborn and Dearborn Heights have been pushing it. I believe that would cause some programming changes, correct, Megan, at CLMUS?
Yeah, and a lot of times the race is taken from a driver's license as well, and those categories are pretty limited.
Right.
So we would have to switch over to observation if we haven't already.
Okay. Tanya, did you have a question?
No, I just wanted to thank Chad for sending me the pages of data for I needed some information on how it was on what offenses was how many people were the offenses, not the citations, and that was some good data to go through. and understand. But definitely, as you just mentioned, the race part, that's a very interesting evaluation, especially when it comes to, the mixed race. We don't know anything about that. And how do you put in, there's a section that says other, what goes like, how do you determine this other?
It's such a low percentage. It's subjective. It often comes back to an officer's education level in that category, in that arena. Then it gets approved by a supervisor, and we have to run back and try to determine after the fact. And you don't have that human being in front of you to make that change, because it's usually a quick interaction with whoever it is. Then to try to jump back would first be kind of odd to try to make contact with the person to ask them what race they are, number one, and number two, we try to handle it through training. And typically we've done that with our command staff to bring the officer in to cover it, because there was a time where we had a number of officers considering people Native Americans when they were not.
So those were a couple of the categories, Indian and Native American. There were so few that when I turned them into percentages, they all turned up as 0. So I added them all together into another category as well.
Thank you.
All right, thank you.
Okay, we're going to jump into the diversion unless there's any more questions. All right. Who qualifies? Wayne County juveniles, first-time offenders, low-level misdemeanor citations, willing participant, and guardian cooperation. So all those things are how we all started. We took a look at it. There was an oversight group that came together, provided some feedback, and we received enough feedback, which we got to this point, disqualifiers. So we removed the live outside of Wayne County. Trustee Foster and Supervisor and I, but Trustee Foster helped turn this on to a commissioner at Washtenaw County. We're in discussions with GrowthWorks to see how that works. But the financial impact at this point, with the low number of Washtenaw residents that would come through our system, we may be able to just handle it internally with our budget to make sure that these children who live in Washtenaw County that may commit an offense in Wayne County have the same opportunity as a child that lives in Wayne County. And that's the way the funding works. Nick is here too. He can help speak on that point, but we're at the point now where we want to open that up. And during the data, even the first round of data, when we presented to the prior board, it became very obvious that prior arrest really impacted a lot of children. So we have removed that as an automatic disqualifier. And we're looking at some felony cases to divert also at this point, to energize the program and give children an opportunity to participate. Some of the things that we're required to do is obviously the parents have to be on board and the victims have to be on board to allow the child to go through the program. If you look here, you'll see the juvenile diversion referral offenses. When school was in, the possession of vape was a larger number, and you'll be able to see, it's pretty spread out otherwise. Possession of vape with THC was one of the higher numbers. A fight at school was another number for referral offenses. This source actually came through GrowthWorks. We tracked the same data, and we included that information here. If you would, Megan, because you track this daily, if you could just go through this program slide.
So when we track the offenses, we're actually tracking like assault and battery as an example. And GrowthWorks broke it down into layman's terms. So we have fight on a school bus or fight at school. I liked theirs better because it broke it down differently. You can see whether it happened at school or not, if they were selling it, purchasing it. So that's why I use their slide. Ours is the same data. It's just the categories are grouped a little bit differently.
If you cover this real quick.
Sure. So 186 juveniles have been considered for the program since the start of it in September 2019. About a third of them, or 36%, qualified. And you can see the breakdown of those that qualified. 4 are still in the intake process. 44 have successfully completed the program at GrowthWorks. And 16 were unsuccessful referrals. That doesn't mean they went through the program and quit. Some of them did. It looks like 4 didn't meet the obligations and 2 recidivated, meaning they got tickets or arrested while they're in the program. But 9 of those 16 actually declined services. So whether they made that first phone call or agreed to it initially, they didn't enter into the program. And then the other 112 did not qualify, and I'll address that on the next page. So the disqualifiers outside of Wayne County, I did all in red. Then you can see felony offenses in orange, and I went through and did each color separately so that you could see that there's multiple disqualifiers for each person. So it might not just be that they live outside of Wayne County. Like the first person you can see they lived outside of Wayne County. It was a felony domestic and they had prior arrests. The reason why I showed that they have multiple is that you can see when you pull out outside of Wayne County as a disqualifier and prior arrests as a disqualifier, you can see who's left to say, okay, now these number of people would be eligible. So 14 were disqualified originally for living outside of the community. 15 were disqualified because they were felony offenses. 31 were disqualified for domestic violence. 29 for having prior arrests, which is a lot. 15 because the victim requested prosecution. Those are usually like assaults or retail frauds. And then 5 juveniles opted out of the program. So they qualified and just chose not to.
And another addition to this, and it came up, I forgot who I was speaking to, but it came from this board, or Lauren, is taking a look at how we market it. We'll probably coach and teach a little bit with our officers. It could be much more labor intensive. And when we're defining the term accountability, there is a lot more accountability when you're going through a GrowthWorks program outside the court, to a large, at least from my perspective, than just going through the traditional court process. So we need to work on that on our side at the police department and just explain the difference. It may help, a certain individual or resident that feels that the child would be, getting off scot-free, for the lack of better terms. If you could explain this.
Sure. So you might be asking, why haven't any juveniles been entered into the program lately? Now they have a few in the last couple months, but it decreased a lot after COVID or pre-COVID. About half of the juveniles entered the program. During COVID, I would say that's where we're at now still, is about 15% have entered the program. And so few because so many fewer juveniles have been arrested. It is still a lower percentage, 10 out of 64.
We're trying to rejuvenate one section of the program, which is for the undisciplined juvenile, where they haven't necessarily completed or committed any type of offense necessarily, but they're just struggling in life. It's part of the family dynamic. There's an issue, and using this resource to help the family out and the child out is something we're pushing right now with our officers. So the JCO1, I'll have Megan explain this in a second, but the JCO1 is, so over the years, everyone's probably heard, hey, they're going to get a warrant for my arrest on the adult side. So that means police officer, detective sits down and writes an application to the prosecutor to review it. The prosecutor then reviews it. He applies charges as they see fit. The officer signs and swears to the warrant in front of the district court judge and has the person eventually arraigned, or at the same time arraigned. Well, through the juvenile justice process, they have what they call a JCO1, and that essentially accomplishes the same mission, but they don't use the term warrants and that type of lingo. They use offenses, and they use this process called the JCO1. It's a piece of paper essentially that the detective or officer utilizes to have a prosecutor look at the information. So if you would, Megan. Go into
Sure.
that.
So I was asked, how many JCO1s have we submitted in the last 5 years by year? And the answer is, I can't give you accurate data at this point. I put in here multiple different ones for Canton. You can see 3 different lines at the top, and all of the numbers are different. And this is just an example of the struggle of trying to get accurate data out of our records management system. They have been tracking JCO1s in our RMS since 2019. It requires the officer to actually fill out a tab in the system while they, or when they do a juvenile warrant request. I asked Clemis to create a report so I could get these numbers. It took them 3 weeks just to get me data and 4 weeks to get a report that I could run myself. So it's not quick. And if you look at like 2019, for example, they say there's only 52. When I did just a narrative search and found at least 90, I can say that the first year is definitely low. And that might be represented by the change of officers doing it from paper to then learning how to do it as an added tab in the records management system. So if they don't fill out that tab, the JCO1 in the report, the way that Clemis needs them to, it just won't be counted.
That's important too, because this started, our supervisor went to a meeting and we're trying to get this juvenile justice program opened up again at 35th District Court. Currently, they shut it down. One of the reasons they shut it down is because of sheer numbers. The numbers that Canton is the bulk of the court. We're setting around 70% of the court's case files right now. And with us having a diversion program, it was not a financial good decision, I guess, to have juvenile justice, it seemed like, at 35th District Court. So they decided to go in another direction. The reason they have that ability to hear juvenile cases is because of, I believe in the mid-90s, our township board and the other 35th District communities entered into an agreement with Wayne County where we were able to hear certain juvenile cases. But right now they're not electing to utilize that because the numbers are not there. It's essentially because of us. And you're going to see the number of these applications go up because there's no other way to vet a juvenile case that we're not diverting. There's no landing place at the local level. It has to go downtown to Wayne County. So this is the adjudicated youth. If you could explain this, you prepared this, Megan.
So the adjudicated youth are the kids who did not qualify for the diversion program. They've now gone through the court process and ended up on probation through the 3rd Circuit Court. Because of that, they're then taken to the CMO program, I believe it's called Case Management Organization through GrowthWorks. So these are the charges each of those juveniles has been charged with. So you can see all of the higher offenses, things that wouldn't qualify for diversion.
You're going to see some of these things start to tie in. So you just heard GrowthWorks on this end of things too. So a child goes through the adjudicated program at Wayne County, they end up in the same landing spot that we are utilizing for some of the low level offenses already through our diversion program. But if you notice the numbers, when you see the number 17 there, that's for 2021. We're at May 18th right now. And all of 2020, we're at 18. That's not because of our diversion program failing. They're just, like I said earlier, there's not a landing spot for these cases locally. They have to go through Wayne County when they're not diverted. That's perfect segue. We're going to pass the mic to Nick and his team to explain the life of a juvenile case when they go through the diversion program and explain their CMO program that they operate for Wayne County and any of their other programs, including rescue recovery. So I'll run the screen here. You ready to go, Nick?
Yeah, Chad, do you want to see if anyone has any questions?
Yeah,
on
sure.
the data? Thank you. Anyone have any questions on the data we just looked at for the diversion program? Or comments? Stephen?
Not really a question on the data, but I would just say, Chad, if there are things that the board can do to help better meet the goals of this program, of the program you previously were discussing, the diversion program, please bring them forward and discuss with us what we can do to help. I know you work closely with Trustee Foster and the supervisor on this, but glad to help and pitch in and discuss as well as vote on changes if you deem them necessary.
Yeah, it's a great comment. Actually, you know, with ideas, I think not only they can be stimulated from the board. I'm hoping this will also trigger some of the certain progressions maybe that the board wants to see with our police department and the criminal justice system. As we look at this data, things will pop out of here. You're going to hear, like when Nick takes the mic here, you're going to hear some different things that they do programming wise. Then we have our embedded social worker coming into play. We're ahead of the game as a police department, and there are certain opportunities maybe we don't know this moment that are coming to be, but I expect to see in law enforcement more diversion programs, and along with that comes probably funding and grant opportunities. So we opened that line last week with 35th District Court. Supervisor and I were there, had a great conversation with the chief judge, and we're looking for just different ideas that serve our citizens better. And it first came through, you know, diversion, you know, so any ideas would be appreciated, and we'll certainly bring back information back to this board.
Kate?
Tanya can go first if she wants.
Oh, I'm sorry. Tanya?
Yeah, so I am hoping that, you know, seeing the numbers for people that don't qualify is much higher than, and I saw the breakdown provided, and it tells me that there are some things that can be expanded, like people not living in Wayne County, or you know, how do we tackle with the issue of multiple offenses, and maybe this program will provide an option in the future so that we don't have people will qualify because there will not be multiple offenses. And I echo Stephen's thought that, you know, anything that we can do as a board, you can, I'm now understanding more about the program, and I am also looking forward to the GrowthWorks presentation to see if we can come up with any ideas on our own as the board, as part of our welcoming community strategy that we have.
Thank you, Tanya. We're, with the slide I have up now, we're hoping, and we believe it'd be certain, just based on the small data set we have to date, that removing the automatic disqualifier prior arrest may help, because from my experience, probably many of those prior incidents could have been related to the context that we had strict enforcement before, causing the prior citizen contact. And living outside the Wayne County, while it's not a high number of children, that's where I think we can carry the burden if we're unable to receive the funding from whatever county it may be. Usually it's Washtenaw County. To provide a little perspective, if you live, let's say, Bridgewater Township or Ypsi Township or something out in Washtenaw County, that child's case gets taken, it goes right back to the county in which they reside. That's why it becomes such an issue. It's not that Canton's investigating juvenile crime in that county, it's because the offense occurred in Wayne County. So that's how juvenile offenses occur. So that might be a question that may come up, because it was confusing when I started in law enforcement why I had to go to Washtenaw County Court for a juvenile. So
yeah, and another issue thing is we border, you know, our township borders Washtenaw County, so most of the offenses, like with the residents of Washtenaw County will be the biggest county that we need to focus on, because our township literally borders that county.
Yeah, and Trustee Foster opened that line of communication. I know Nick's been working in the background, and they're just like every county government. It's slow moving, but there was a lot of interest in supporting this. I think they appreciated what we're doing. I don't think anyone else necessarily is doing the same thing at the police level, or anywhere I can think of necessarily besides out of state. But they were open to working with us on this. They just, nothing's been formalized unless Nick can speak to that.
Kate?
Thanks. Yeah, I also want to echo what Trustee Snyderman said, and anything we can do to help out, I'm happy to help. I'm concerned about the number of families that are declining the services. So wondering, what we can do to increase, the number of families that participate. Because I think it's in their child's best interest to go through the program. They may disagree, maybe that's why they're declining, but if we, do we ever follow up to find out, what are the reasons for their deciding not to go through the program?
I just have a few incidents where I know of. Megan may have more just because she's close with the program manager day to day. But what I've heard so far is, this a lot of the family dynamics are complicated. Like we had a recent one in the last week where it's a 9-year-old with a box cutter, and we sent an officer out twice. We had the sergeant multiple times call. I believe GrowthWorks may or may not have received the referral to begin with, but they did not make contact with GrowthWorks. So we had vetted it so many different ways trying to get that child into the program. We're just kind of out of exhausted. The less we take custody of the child ourselves and take them back and forth. And I'm not trying to be sarcastic. It would take that with that mother, it sounds like, unless something changed here in the last few days. We're finding that pretty complex family dynamics, in some of these situations that run deeper, and that's where some of these ideas about embedded social worker came from.
Right, and maybe when we have that person online, that maybe these kind of situations would be better dealt with.
Right.
But again, if we can find out more information about why families are declining the services, I think then maybe we can address the concerns there and hopefully get more children into the program.
All right, we'll work on that, certainly.
I agree. Summer?
Just wanted to make the quick comment that the diversion program requires parent participation. So I don't know if that's a reason why parents aren't signing off for their children participating, but I do know that it's a big part of the program and it leads to the success of the program when they participate. So I don't know if that is a barrier for some of the parents. And I just wanted to make the point that it will be interesting to see the data next year or in the coming months after some of the things that Chad and his team have put in place to allow more children to participate in the program, like getting rid of the Wayne County requirement, whether or not Washtenaw County pays for it or we end up paying for it on our end, because it's not, a significant number of children, and getting rid of the prior arrest dequalification. And the other thing that we talked about was thinking about how we talk about the program to victims or survivors, because we noticed that there's a significant number of children who are not able to participate because the victim requests prosecution or restitution, and let them know that this is it is, you know, a real program and it's not just they would get away by paying a fine or their parent paying the fine.
Right, and I think that was a really good point. And something that I think we should definitely look into. Sorry, I'm kind of butting in here. But I really liked your comments, Summer. And yeah, that's why I kept talking about families participating also. It's because of the parent component. But if we can find out, you know, what the problem is it because parents have to work, or if there's a transportation problem, I think, you know, or something else, I think that will help us understand how we can, you know, address concerns better and hopefully get more children in.
Hey, Chad, quick question. I know that you have Sergeant, I think it's Sergeant Schulman, am I correct? That's tracking these cases. Does he do any tracking on why, like whatever reasons? I mean, does that data exist?
I have to ask Megan that. I don't know if there's a way that we've tracked that to date. I know it'd be anecdotal and then just from memory, from my standpoint in my conversations with him. I don't know if DC Wilshire knows of any tracking to date, but we definitely will now.
So the tracking is exactly as you said, anecdotal. So examples are parental choice or mother declined services, not making contact with GrowthWorks, juvenile and parent decided. I'm just trying to see what some of them are. Do not complete obligation to contact GrowthWorks, no contact made, parental decision. Again, it doesn't give the why. It just says that they opted for a citation or that they just decided. But the why is obviously an interesting point.
I can kind of add to that. So some of them on our end did actually go through like the intake process and were assessed. And once they were given, you know, the information as far as what group that they were deemed appropriate for, some of the parents just felt that it didn't fit within their time schedule. They might have had other kids. Some just didn't agree necessarily because we do more than just a life skills group. There could be like the substance use. So some of them didn't feel that their child needed it and they declined. So there's various reasons. So some of them actually did start the process as far as intake, but just after that they declined. Some of them declined prior to, or once they called, they said it just didn't work once they heard about the program. So on our end, we do track that information. I don't have all of it broken down in front of me right now, but.
Thank you, Tiffany.
You're welcome.
That was important to hear.
Okay, thank you. Any other questions? All right, thanks.
Hey, Nick, if you don't mind to introduce yourself and your team and maybe take us through you know, some of the youth assistance programs and the CMO program and maybe hit on rescue recovery.
Sounds good. Thanks, Chad. And good evening, everyone. Thanks for having us. We really appreciate the opportunity to come and talk with you. I'm Nick Griswold. I'm the CEO of GrowthWorks. I have with me Jennifer Seibel. Wave, Jennifer. Hi. Jen runs our CMO, which we talked about, the care management organization for adjudicated youth. And then we have Tiffany Bochart. She's our lead diversion coordinator. And so we're going to talk a little bit about what GrowthWorks does. In the interest of time, I'm going to skip through some of these slides. I'm assuming that Chad either has or will provide them to you. And so you can look at them at your leisure and we can talk more. And if you have questions, you know, jump in. I'm fine with that. But I'm going to skip over some of them because I think that the discussions that we're having, like the one we just had, are really good discussions. And I'm excited to get to those. So just a little bit about our mission and values. Chad, you can skip to next slide here. Keep going. Thank you right there. I did want to stop for just a minute, just in case you haven't heard of GrowthWorks or you don't know much about us. We started in 1971. We're actually a youth drop-in center located in the city of Plymouth, right in downtown. We've expanded, obviously, quite a bit since then. This is our 50th year this year, and that's really exciting for us because it's not as common as you'd think to find nonprofits that have been around for 50 years like ours. We, when we operated the youth drop-in center, we saw that there was more going on with the kids than maybe a lot of the adults around in the early 70s would like to admit. And so we formalized counseling and treatment programs to address those challenges. The juvenile justice programs and our clinical substance use disorder treatment programs are accredited by Joint Commission. That's by far the gold standard for healthcare organizations. The site reviews are extremely rigorous, and we take a lot of pride in that. That really our care of clients meets the highest standards that are available to us. Last year, we served over 2,000 clients total across all our programs, and we offer programs and all the things I've listed before. We're going to talk mostly about juvenile justice type programs tonight. Chad, you want to skip ahead? So Chad, if you don't mind, if you can skip forward to the diversion section, and we're going to have Tiffany go first because it's just what we talked about. So it's a great lead in. It's also, when we talk about levels of care within the juvenile justice system, it's obviously the lowest level of care in terms of sort of requirements of the family, potential consequence. I think it's a good place to start, and then we'll move up from there to talk more about the care management organization. So take it away, Tiffany.
Hi, I'm Tiffany. So as far as our demographic information, for the race, this is how the family self-identifies. So when we have a family call in, we have a questionnaire that we ask them. So as far as race, this is them self-identifying. So it's fairly accurate. The unknown section is the referrals that we got that no one called on, just because we only have a name and then what the offense was. So you can see there, if anybody has any questions. So here we're going over common referral offenses: status offense, undisciplined juvenile, communication threats, curfew violations, substance use, trespassing, disorderly conduct, damage to property, larceny, truancy from home and school. And I know the slides that you saw from Chad showed a lot with the vaping at school, a lot of school related referrals. The past year, obviously they slowed down since COVID. It seems like they're kind of starting to ramp up. We're getting a lot more of the curfew violations right now. I think, the juveniles are back out, the weather's getting warm, so we're going to kind of see a little bit more contact. And then just so you know, originally we weren't able to take a juvenile over 17, but they've changed that. So now we can take them over 17, which is helping expand the program too. So that's been really helpful. So this obviously shows the referral offenses that I know Chad went over a few minutes ago.
Tiffany, I'm going to jump in here just real quick on that last slide, just to add, because you made the point and I want to maybe second it, is, a lot of the offenses that are listed here are either school related offenses or they're observed at school. And so it shouldn't go unnoticed that, particularly with juveniles, when we're not in school, how many mandated reporter folks or how many other adults outside of their own home don't get to see them when they're not going to school on a daily basis, right? So think about teachers, social workers, counselors, assistant principals, at the high school level, for example, all these other sets of eyes that aren't necessarily on youth. And so some of these, maybe what we consider more minor offenses, or certainly offenses that should be eligible for diversion, tend to go down. We've seen since the pandemic has started, and Tiffany mentioned they're starting to ramp back up. And I think it's because we're seeing schools start to go to more in-person settings, right? At least in a hybrid case. And that just allows school officials, police liaison officers, et cetera, to see kids more face-to-face and have an understanding of how they're doing.
So how the process works for diversion, because we can have referrals from parents. So parents can call in if they're struggling with their youth. Schools, obviously the police, we have, a special relationship with Canton PD, and then we've also branched off to Livonia PD, and it's been really helpful. It started off, the YEP diversion program started off really with right track referrals, which is, so they go through the actual court process. There's a JCO1 sent down, and then they look at it and notice that the youth may have, a minor offense, no priors, and looking at do they really need to be on formal probation? So they can put them through right track, which also gets sent to us. And if they successfully complete programming, then they don't have any offense history. So the ticket is dismissed or the petition's dismissed. So therefore they're given that opportunity. And then we also get a lot of referrals from mental health agencies. So therapists will contact us stating that, they might need a different process, like a group setting or substance use So once they contact us, we schedule them for an assessment. It's a pretty lengthy assessment. We gather a lot of information just because we know just the referral fence is not always as telling as what's really going on. So we really do, a lot of background work to make sure that we're giving them the appropriate services. So we can place them in different programs such as our life skills group, which meets once a week. Then we have outpatient substance use. That's 2 to 3 days a week, depending on their use, how often, there's a lot of different variables. We also have a mentoring program here. So that's more gender specific, where our life skills is both male and female. We do have family therapy. There is parent programming. It's obviously changed since COVID. We do have the life skills group back in person right now, but our parent group is all online via Zoom. And unfortunately with COVID, the parent participation has gone down, but youth can still participate in the program even if the parent is unable. So
I think, something Tiffany touched on is sort of our unique relationship with Canton Township. And I've told you, Madam Supervisor, and you too, Chad, that, Canton Township is a really wonderful partner for us, because it seems like whenever we have a fairly progressive idea, or Canton Township does, the other side's always all in. And the diversion program is a direct result of having, I think, that kind of relationship that spans, decades now at this point between our organizations. And so what, as you probably know, but just maybe to restate it quickly, is the typical process for diversion does involve, like Tiffany said, right track, which is a complaint filed down to the prosecutor's office. Prosecutor has to review the case, contact the family, offer diversion. All those steps take time. And so sometimes it can be weeks from the time that an offense is committed to the time that they actually end up referred for an assessment with our organization. Our partnership with Canton Township has turned those weeks into merely days between a committed offense and the time that we're starting services, which is really important. I have 3 kids. Those of you that are parents, that when the consequence most immediately follows the offending action, you get a lot more bang for your buck than when it's perhaps weeks or even months in some cases later. That's a lifetime in a child's mind. And so this really allows that to happen. It really allows the offense to happen, and then have that consequence of action and restorative practice immediately follow, which is a big deal, because it's, like I said, it's only happening here in Canton, and we just started the process in Livonia. But it's fairly unique to even Wayne County and then broader across the state.
I think it's important too, if you don't mind me to interject, Nick, this idea came up and I contacted GrowthWorks. They jumped on and helped design the program immediately and found a funding mechanism. And that's why it's free for us. And I really appreciate, how you made it happen, and you made it happen fast. So thank you.
yeah, and just to piggyback off what Nick said about the time, we just received a case through the court system, through Right Track, that the offense occurred in October, and the parent and the child were like, this is ridiculous. It's like 6 months after the fact, so they were frustrated. So we do have a lot better relationships with the families when it's immediate, and they aren't kind of like hanging in limbo, because they cause them a lot of anxiety as a family, which is understandable. So we definitely, we take pride in being able to get families in fast and start the process. So, it makes more sense to everyone. And definitely, I would say our relationship with Canton is amazing. Like the department, is just definitely the standard. Sergeant Shulman and I regularly speak, and really just about getting the programming, keeping it moving forward, even talking about bringing officers in to build that community relationship with the kids, which is really important. Even we talked to the kids about their arresting officer, or the officer they had contact with, and they've always had really positive things to say. So I think that speaks volumes about the department and the city, so the township.
I have the programs offered slide. Do you want to move past this?
Yeah, I kind of touched on it. So.
Okay.
So this is our breakdown from after the assessment was completed, what program they were deemed appropriate for. So 15 of them went into the intensive outpatient substance abuse service. So that one is, it's definitely intense. It meets 3 days a week for 2 hours. That is still via Zoom right now. Then the outpatient, 6 of them met criteria for that, and that's twice a week for 2 hours. Mentoring is once a week for 1.5 hours, and then life skills is once a week for 2 hours. So, and with the outpatient substance use groups, those average about 6 months in programming. So our funding covers 6 months for the kids. And then for like life skills and mentoring, they average about 3 months. And then as you can see, we had 63 clients referred, 83% completed the terms and condition of the program successfully. And then we do our own data and tracking. And so only one of the youth that were referred ever formally entered the CMO system. And that one was actually, the petition was already filed from the family prior to Canton having contact with them. So Canton had sent them down and we started him in programming here before he got down to the juvenile court. So he already kind of had some interaction with the GrowthWorks prior to being placed formally. So, and then these are some of the reasons for the lack of completion. So we kind of touched on it earlier. So
I think it goes with, maybe without saying, that, you know, the primary purpose of a diversion program is to divert the youth from further court involvement, right, or future court involvement. And so to have 1 out of 63 clients, you know, we talk about success and program completion and metrics, and that's certainly something that's important to us and that we monitor. But I think that the rubber meets the road at recidivism. And so having 1 out of 63 and that already being a special circumstance even in itself, I think says a lot about the program, the youth that are in the program, and the youth that Canton Township officers are referring into the program. You know, has a lot to say about those folks and the quality of the work that's done. So thanks, Tiffany. I don't know, Madam Supervisor, if we want to stop for questions or if we want to keep going into the next level up, which is the care management organization for adjudicated youth.
Does anyone have any questions? No, go ahead. Thanks.
Okay.
Oh, I'm sorry. Lauren Kogali.
Okay.
Lauren.
Can I just ask you a quick question? I'm sort of curious comparatively. Do you know what the completion rate for the Right Track program is?
not offhand, but it's pretty successful too.
Okay. I was curious. Thanks.
Mm-hmm.
You also, I mean, maybe it's in the next section, but I noticed that you only referred to substance abuse, but domestic violence is not always that, or is that going to be discussed in the next section?
So the substance use was just, so they may have came in for a domestic violence, that may have been the referral reason, but after doing the assessments and gathering the information, they met criteria for like our substance use disorder groups. Just so like the referral offense does not always determine which group they're in. So that's why we do have a pretty intense assessment process just to make sure that they're getting the appropriate services.
Okay, but you do provide other services other than just substance abuse, right? For those that don't fall into that?
Yes, we have life skills and mentoring too.
Okay, thanks.
Mm-hmm.
And so next we'll have Jennifer kind of go over the basics of, so, you know, when the offense is such, or some of the things we talked about before, and you know, kids are adjudicated through the Third Circuit Court Juvenile Division downtown. Once that adjudication is complete, then they come to the care management organization and we kind of take it over from there. So Jen.
Okay. Hi, everyone. My name is Jennifer Seibel. Thanks for having us tonight. So this first slide, so we actually, Western Wayne CMO, the department we're speaking of within GrowthWorks right now, is actually one of 5 care management organizations in Wayne County. So kids are assigned to us based on where they reside. So this slide just speaks to all the communities that we service. So we service 17 Western Wayne communities. This is Canton specific information. So these are, and Chad kind of went through this before regarding a lot of the offenses, the various offenses we've received over the past couple of years, kids that are adjudicated and placed within the care management organization. So I think we probably hit this enough. Okay, so just quickly what the CMO process looks like. So as Nick said and Chad touched on, these are the kids that a JCO1 has been approved by the prosecutor, formally had a hearing in front of a referee or judge down at 3rd Judicial Circuit Court. The client has been adjudicated. at a disposition hearing, which disposition would equate to, I guess, what would be sentencing in the adult end. At that time, if the client or the youth is placed on what's called level 1 probation, which is kind of what we envision as traditional probation, where they go home and they're on probation within their parent or guardian home. They also may be placed on level 2 probation, which is out of home probation. So those are kids who we are going to be looking at placing them in a residential treatment program out of their home for a period of a time. So we service both those populations. So within 24 hours of the disposition hearing is typically when we're made aware that we've received a new assignment, again, based on where they reside, determines which care management organization they go to. Within the first 2 weeks of receiving a new case, we're completing an intake. There's many assessments that are done with these youth. They actually receive through the county assessment even prior to going into that disposition, kind of like a pre-sentencing report. It's called the YASI, which is used to help the jurist decide what makes most sense for that client. There's referrals being made during that time. Oh, kind of skipped too quick, Chad. Go back one. And then 2 weeks and beyond is really where the client's engaged in services. Our case managers are monitoring their compliance with their court-ordered services or the services determined necessary by the various assessments. It's fluid, obviously. These kids and their dynamics and home dynamics change quickly. So our case managers are really instructed with being able to respond at any given time when there's non-compliance or maybe a needed intervention. They meet with the clients, they're mobile. So our case managers are out in the field. So they're going to schools, they're going to the homes, they're collaborating with the treatment programs that the clients are involved in. So kids in the community on that level 1 probation status, we're meeting with at least once weekly. And then the clients that are in that level 2 status, they're going to meet with them at least monthly, if not more, in that residential program. And then eventually when those level 2 clients have completed their out of home programming and it's been determined that they are outpatient ready, they continue that probation, time on probation in the community in that level 1 status. So we follow them through. So we have kids that may start at level 1, go to level 2 because their probation is violated, but then come back to that level 1. So we follow them throughout those 2 statuses. Okay, next slide, Chad, please. Thank you. So just a couple quick program highlights that I think are unique to our CMO is the first and foremost are restorative practices. So we have developed what's called a community team meeting in each of our communities that we work with, those 17 communities. So we meet with members from the community each month, particularly members who are invested in juvenile justice. So school resource officers, some school teachers, all sorts of individuals, but part of that meeting is to really just collaborate and come up with solutions to addressing client needs. But we also use it as restorative in regards to, we have the client from that community present at the team meeting so that they can, regarding a balanced and restorative justice approach, be able to make amends to their community. And it really then turns full circle where we see the kids be able to not only own their behavior, but then make positive connections with those community members that maybe weren't positive when they first started this process. And this just, the list goes on regarding various things. We offer mentoring. We try to keep our case managers' caseloads very low. So we have mandates by both the state and county as far as what caseload ratios look like. We try to keep that even lower just so that our case managers are developing a quality connection with their clients and being able to respond in an effective way. Something else that's really unique is we have several residential programs that we have embedded our treatment staff in. So we are also within the residential spectrum as well. And then lastly, I just want to hit the care pass reduced length of stay. I won't go too much deep in the weeds with that, but Tiffany kind of hit on that, is that really we look at cases as not the offense defining the client, and that our real goal is to really get to what are the root causes that is driving the client's behavior, and let's set the services up to be around that. In that the idea, if we're treating that, then we're going to see some positive outcomes. And that's really what the idea is to CarePath. If you put in the right right services, addressing the right behaviors and the right treatment needs, they're going to have a less shortened time within the juvenile justice system.
If anyone from the township board would like to participate in the community team meeting for Canton, please reach out to me or to Chad. Either one of us can help you, arrange a time that you could be available to join in that meeting. They're pretty powerful, and there's something that to really get you kind of have to see for yourself. So that invitation is open to all of you.
This slide speaks to our recidivism. So this one is not Canton specific because the sample would have been small that the graphs would have been, but so this is regarding all the communities we serve. So we actually follow clients once they're terminated from the care management organization. We actually follow 2 years out to see if there's been any sort of felony offense committed on that client's behalf 2 years post termination. Because to us, success is that there's been a lasting effect that we've created in this client's life. So this speaks to that. So for example, the 27 FY27 cohort, we followed them and monitored them through the various systems to see if there was a felony offense that they were convicted of for 2 years. So we closed that group out 2 years later, 2019. So these slides speak to our recidivism. I have to move here because everybody's screens are over my numbers. But this is something we're really proud of, is our low recidivism. I think, if anybody was to look at national recidivism rates and then look at these Wayne County rates, recidivism rates, it really would speak to the success of the care management process within Wayne County, not just GrowthWorks, but the entire care management organization, which is unique. No other county in the state of Michigan operates a care management organization system. So Nick, is there anything you want to add regarding recidivism on this slide?
Just that, historically, so the CMO program was started, that public-private partnership between Wayne County and organizations like ours in 1999. In the years leading up to that change, recidivism was well over 30%. I don't have the exact number in front of me, but I think I heard 35% in 1999, which was the last year. So you can see that, and not only does that help parents and kids, obviously, because we're doing a great thing for them, but just even the burden on the system, if you think about all the moving parts that go along with that, it's quite a shocking revelation, and something that we don't probably talk about enough, honestly, as a county and as agencies, but it's come an awful long way since this partnership began, 22 years ago now.
Okay, next slide, I believe.
So I believe Trustee Foster might have a question.
Okay.
Yeah, just a clarifying question on the recidivism. Do you track once they age out and are no longer considered a juvenile if they were to recidivate, or is it just as long as they're a juvenile?
Nope, we also track into the adult. So as long as they're we will track them, like I said, 2 years post termination. So if a client's terminated in, let's say 2017, their wardship is discharged, we will monitor that until the close of 2019, whether that's within the juvenile or the adult. So we also peruse the adult systems to see if there's anything going on in the adult end as well.
That's awesome. Thank you.
You're welcome. So this is specific to Canton. So from FY19 to current date today, or as of 2 days ago when I did this, we looked at our successful and unsuccessful. So in what kind of qualifies that is, were these clients, did they follow the terms and conditions of their probation? Did we terminate at a time when they were drug-free, offense-free? So based on reviewing those 21 Canton clients that have terminated from court wardship, and these are just the CMO ones, that 95% were successful at completing their terms and conditions of probation. And this just, again, I think mirrors the slide where we saw the graphs regarding the felony convictions. For me, this is a little easier to read. So for instance, this in 2020 closed out any clients that were terminated between October 1, 2017 and September 30th, 2018. So that was 73 clients. And this was, again, across all the communities we serve. and only 5 within that 2-year period were convicted of a felony conviction, putting us at a 6.8% recidivism. So this just speaks to that chart, just in a different way, different visual.
That's it for our slides, Chad. I know that you wanted to hear about Western Wayne Rescue Recovery. So if I can just give the 30-second plug maybe on what that program is. And then obviously we'd love to stay for the discussion, any other questions that come up. Western Wayne Rescue Recovery is an emergency peer coaching program that we operate in partnership with the Conference of Western Wayne and St. Mary Mercy Livonia Hospital. And the easiest way to describe it is that if a client is in crisis or active overdose or comes to the hospital in the emergency department, we can be reached 24/7, 365. We dispatch a coach to either the police department or to the hospital, depending on where the client is. And I like to say that we get there about as fast as you can have a pizza delivered. 60 minutes or less is what we guarantee. And honestly, it's usually about 30 minutes or 35 minutes that we respond from the time we get the call. And the reason why that's so important to be there so quickly is that contemplation stage, that moment of clarity, as our coaches like to call it, can be really fleeting, even minutes sometimes. And if you can get there with the right intervention at the right time, it makes a world of difference. Our coaches are our employees. They're trained by us. They're certified through the state of Michigan. They have to have 2 years of recovery under their belts already, minimally, before they come to us. And their education is really that lived experience. You know, they've been right where that client has been, and it's really powerful. Their main goal is to help that client get into their next level of care, whatever that may be and whatever is appropriate for them. I'll tell you that most of the time they don't come to Growthworks. They go to other partner agencies around the county because that's what's most appropriate for them. But our goal is to get them turned around and get them on the path to recovery right then and there. To date, well, through the end of March. So we do filings to the conference and to the state of Michigan because the program is funded by the Department of Health and Human Services. But through the end of March, we had received about 700 referrals from October 1st to March 31st across the Western Wayne catchment area. Most of those come from the hospital, but we're starting to see more and more from police departments. And Canton was the first department that we kind of brought, like I said before, we brought this idea to. It was very well received, and the program was very immediately implemented. Some of the other things we've done with the program is before it was more readily available, we provided Narcan to any of the department's officers in Canton and other communities that would want it for their duty bags, because back then it's more readily available now, which is great. But back then, sometimes you had to wait for EMS or fire to get there to administer Narcan. And if the officer's there a couple, 3 minutes ahead of time, being able to do that, I think we know if someone's in an active opioid overdose, 3 minutes can mean literally the difference between life and death. And so having an officer there was something that was really important to us. And so that's just a quick snapshot on how that program is going. And we certainly appreciate all the support we've received from the conference and elected officials that make up the conference and from Canton PD for that.
Thank you, Nick. That's exceptional. I think the board, and I know for myself and Deputy Chief Craig Wilshire, that our partnership with you has been critical for our success. And at the very least, saving a few lives here in the most recent years with Narcan, and you coming to replenish the Narcan for our officers has been exceptional. And it's actually real helpful because when I started in law enforcement and Craig started, we used to think, there was no hope for those addicted to opiates, and we're really seeing that change. And, exactly what you're saying. Number one there at that slide is restoring hope. And I think today and what we've done in the past is we'll generate some new ideas as we look at the criminal justice system. So thank you for participating. And again, without you folks, it's not only in the last few years. In 1996, when I started in February, we were providing cards. We were going to meetings and with juveniles, and those ideas and those times will help generate some of the things we're doing today. So thank you again.
Thank you. Are there any questions or comments? Thank you very much for the presentation. I know that the Right Track program, through some of the facilities that they use, require community service. And that's got a good component too also, because it kind of gives the kid or the youth a little bit different perspective on things. Have you guys incorporated community service? Are you looking to? I know we talked about that last year.
That's something that we've been discussing. Obviously, COVID has kind of made it a little bit difficult to find, because we wanted to be meaningful, not just them picking up garbage, but making a connection with the juveniles and the community, and making it kind of more impactful and just building those relationships. So that's something that we do have, on our to-do list, to contact local agencies to see who's willing to have, juveniles in there, because sometimes there's age, restrictions and stuff, and just what we can do to be of help to the community and make that connection. So if you guys have any ideas or know of any businesses that be willing, please send them our way. We'd love to know that. So.
Okay, great. Thanks. Anyone else? Any questions or anything?
Well, just thank you so much for all you guys do in the community. I know when I was on school board, and several of us have been on school board, GrowthWorks was a savior for some of the kids facing expulsion in our community. And of course, with what you presented today. So thank you.
Yeah, I want to say thank you as well. A wonderful presentation, and thank you for all you do for our families and our children. Thank you.
Yeah, I want to say thank you also, Director Ball. I don't know if we want to invite GrowthWorks back at another time to talk more in depth about the rescue recovery program, because I don't think Kate or Tanya heard it when the board did it before. But I think it's a really important program, and I know that when funding for the program was in peril a few years ago, it was important for our elected representatives and senators to hear from communities that really benefit from those programs.
Certainly, Trustee, I think that'd be a great idea, especially they're, from what I understand and what I see and what I've witnessed, a step ahead in programming as it relates to recovery. The education level of the coaches and the tracking afterwards is something to see, and it's impactful to see some of the outcomes. People's lives have been changed, so I see that as a study session in the future.
And Chad, I would just quickly add to that the funding seems to be annually in peril, Trustee. So we can always use that support. We're subject to the same, state budget cycle that we are in so many other areas too, right? And so having that conversation or being able to have those kind of meaningful conversations are really, really helpful to help the folks in Lansing understand what our needs are here locally.
Yes, I agree.
Tanya?
And this is some great information. I, as a first-time board member, did some really commendable work that GrowthWorks is doing. And Nick, as you said, that we have the opportunity to be part of the meetings if you wanted, you mentioned. I am definitely interested, and I'll get in touch with you on that.
Anyone else? Kate?
Am I muted? I can't.
I can hear you now.
Okay. So yes, I want to echo what everyone said. Thank you so much. Thank you, Anne Marie and Chad, for answering my questions ahead of time. And thank you, Megan, for wonderful presentation. Thank you, Nick, Jennifer, and Tiffany, our partners from GrowthWorks. I really appreciate everything you do for our children. So, thanks so much. It really was a really interesting and fascinating presentation.
We're not done yet.
Michael?
Yeah, I'm intimately aware of both this program for a while, and also with my involvement with GrowthWorks as well. But I just want to say I appreciate the study session in general from start to finish. Obviously, partnership we have with GrowthWorks is fantastic. We do a lot of good work in this community. It's been I'm grateful to see how the community has changed, how we deal with adolescents from where we started with the model of the 80s and 90s, the combination of just say no and zero tolerance, which resulted in a couple good decades of some people getting finding their way into the justice system, and some of them never finding their way out. Some of those people aren't with us anymore. We've come a long way. We've learned a lot about brain development and about how to best handle things from a public health and a community health and a public safety standpoint. And it's really, I'm grateful. I'm grateful that the board has had the courage to go in this direction, that public safety has been willing to be a partner and go in this direction, and that GrowthWorks has gone with us. So thank you.
Great, thank you. Anyone else? Well, thank you very much. Thank you to our guests. Thanks to GrowthWorks team and Chad and Craig and the board members.
We have a little bit more.
Oh, you do?
Yeah, just a few more slides.
Oh.
I apologize.
Okay.
Address some other issues, and it was just a way to segue into juvenile justice and the CMO and rescue recovery to fit GrowthWorks in. There's some questions that came to us over the past year, and I'd like to highlight some of the stuff we're doing with allegations of misconduct and use of force before we let you guys go home. So criminal and non-criminal police work, not the best segue, but here we are. And we define those this way. Criminal and traffic police work, or traffic stops, investigations, crashes, citations. Those are coded as criminal traffic. Non-criminal is everything else. Civil matters, assisting the fire department, welfare checks, mental health calls, family trouble, and assisting citizens. I'd be remiss not to say some of these are just intertwined. It's not uncommon for an issue in the home where an offense has occurred, or in the street where an offense has occurred, where there's a welfare issue, a mental health issue, and that's where the progress will be made in the coming years. If Megan, if you can help out here, you put this together to help explain some of criminal and civil and what's trending now with our data. Is she still here?
Sorry, I was talking and you couldn't hear me.
Oh.
So the criminal traffic incidents represent roughly 85% of the calls for service that police handle. The other 15% are those civil non-criminal incidents. I think this was sort of a response, or this slide is sort of a response to what do we do with a social worker? So these 15% of the calls for service are the areas where a social worker might be best used.
Right. And I still argue that most of the criminal issues that we deal with to have an underlying
absolutely
need that will be referred, and it is our anticipation that we'll just inundate this social worker once they're in place.
On the next slide, you'll just see the verified offenses. What are those top criminal traffic offenses and what are the top civil non-criminal offenses? And you'll see them all here, anywhere from traffic to suspicious incidents on the criminal side, and on the non-criminal side, we have civil matters, assisting the fire department, welfare checks, loud noise, all the way down to family trouble.
Okay, when we address use of force, I don't know if there's any questions on those last slides before I move over to use of force, and Deputy Chief Greg Wilshire and I can bounce some, relay some questions back and forth, and Megan might interject as needed. But before we move on, are there any questions about criminal versus non-criminal? Keep in mind, criminal is not necessarily accurate when you look at traffic offenses. By and large, are considered civil cases, but we lump them up with police matter for this topic.
Kate, go ahead.
So this might be a silly or weird question, but it just struck me, and I'm wondering, do civil incidents, civil matters ever turn into criminal ones once the police get there?
Most often, our domestics type family situations start in that realm. From my experience, I don't know if the numbers prove that, but it just feels that way. Some people would dispatch it as a civil matter. The police go there and it turns into a crime, or vice versa. You're dispatched to a family offense type complaint, and the probable cause isn't built, and it becomes a civil matter. So it kind of works. It's real fluid back and forth based on the facts and circumstances that are being investigated by the officer and how the situation's resolved.
Thanks.
Okay, when we look at use of force, here we are. This is the demographics that break down the use of force incidents. In 2019, there was 57 incidents. In 2020, there was 61, and you can see how it's broken up by the demographic. Use of force analysis based on the call type. So we try to bring it all together a little bit based on the issue that the officer was resolving at the time, the offense that was occurring at the time of the use of force. And that will help understand or provide some context to what the officers were dealing with. So it's, primarily, it's fraud and domestic type situations that had the highest number, and traffic stops. And then by and large, that's what the officers deal with here. So it's logically why the numbers are higher in that arena. Before we go into citizen complaints, and with these two slides, you may have a question or two. Just for knowledge too, Craig might want to jump in here. We document every type of use of force. Not that we're the unicorn, but you'll find like some of our partner agencies that have the similar standards will document it similar. Some agencies don't have the time or maybe the same standards in documenting every use of force. So often when we get compared to an agency, it may not be like Canton Township and they have the same standards. It's going to look like our use of force is much higher than other agencies. But when you start breaking down the type of force, it could be, the weapon was displayed, the person was taken to the ground. There's not like these all-on assaults or, officers shooting at individuals, that type of force being used in Canton Township.
Yeah, the one thing that we do every year, and we've done for the past several years as far as our accreditation, so our international accreditation through CALIA, is we actually do a comprehensive report every year. We actually had one of our former officers who was he's a use of force expert, works for Human Factor Research, actually came in and utilized our data to actually do some of his research, and he wanted to take it back, and I haven't seen the data presented yet, but however, he took it back because of the low amount of force that officers use based on the high volume of calls that we actually have. So they were actually impressed with the ability for our officers to actually de-escalate situations and go to other alternatives instead of using force during situations that may have required it in other jurisdictions. Their training and experience. We have a police legal advisor who continues to update our officers on use of force and the legal standards that apply. So our officers are very well versed when it comes to using force and the application of force.
I'd like to take the opportunity to foreshadow a little bit. Craig brought in most recently some different ideas, and virtual reality is our next step. We're doing testing. I don't know if Craig, you want to jump in and speak to that point, but de-escalation is not only just a box that we check here, but we actually do it. So if you want to speak to how we may accomplish that in the future.
Yeah, we have a use of force simulator system now called Milo. The system's, I can't remember the exact how old it is, but it's a very antiquated system. I know the trustees have actually utilized the system. And I think Diane Slavin was one of the best at utilizing that system the last time I saw her do it.
And Summer also.
Summer. So yes, they were very good. This system, to upgrade that system is quite an expense. So looking at that, there's a few agencies that have it as far as larger schools and larger agencies that can actually have the system. It's about $150,000 system. The issue is it's very sensitive. A bump of the screen would require a technician to come out and recalibrate that system. So really not making it, and the room, we really don't have the room. It's a very large system. So one of the things I continue to look at is how can we still accomplish training our officers in de-escalation and use of force with a system that would, not only take up less room, but still accomplish it. And we actually demoed 2 virtual reality systems last week, and I would like actually, it was amazing the technology one of them had as far as how realistic it was when it came to actually utilizing force, movement of the people in the screens, the options that you actually had to change scenarios, change dynamics of the scenarios, how the person actually looked. I mean, one of them I think had 30 different scenario bases, and then had another 30 scenarios for each of those. So, just a plethora of things that officers can do to test their abilities when it comes to using force. So we're going to continue to look at that. I think there's one more system that we'd like to look at just to make sure that we have a proper comparison before we bring that forward.
Any questions about use of force? And maybe Craig, just run them through. Let's say I use force tonight. What, as a police officer, what would Chad Ball have to go through? So they have some understanding how it works with reporting and oversight.
There's quite a few steps in that process. So once your force is utilized, you have to notify your on-duty supervisor. Once the on-duty supervisor is notified, then there's now not only a police report has to be completed, but also a use of force report. That use of force report is then reviewed by one of our use of force sergeants, who basically considered our internal experts to try to determine whether the force was justified. Once it's signed off by that use of force, the person, again, that includes an investigation, looking at the video, reading the reports, and possibly talking to the officer depending on the situation. Then it's reviewed by the shift lieutenant, who then forwards it to me, and then I review both. And again, in each one of those stages, the reports are all reviewed and the videos are reviewed to ensure that the force is within reason. And that's sometimes, again, if there's anything in question in our use of force, or public or legal expert will also review it too.
Thank you. If there's no questions, we can move on to citizen complaints. I'll pause for a moment. So in 2019, we had 63 complaints filed in our organization, and 25% were founded. Those are either resolved by discipline, coaching, variation of both. We're also, it'd be important here in a few moments, I'll have Craig speak to a program that he helped generate with Director Meyer, which was an educational based discipline programs, and he can speak to that. But back to the complaints, in 2020, we had 48 complaints. There's, I would say it's a lot to do with the less calls for service, why we went down to 48 complaints, but we're still setting at 25% founded complaints, 69%, 67% unfounded for those 2 years. Each complainant receives a letter from my office detailing what investigation held, then also the any resolution that we may have taken or to resolve the situation. So that goes through essentially the same process that you heard with the use of force being used. So the employee will be used. Sometimes the union will be there for the police employee, whether it's at the command level or at the officer level. The investigation will then be reviewed by the deputy chief. Then it'll come to my office. And there's 2 things that could happen here: is discipline or educational based discipline, or the complaints unfounded. And when you look at the types of complaints, this breaks it down. Policy, rule violations, and service complaints were more 2019. I don't know why it dropped that dramatically in 2020, but it happened. Conduct is a high number also that we find initiate a citizen complaint, and we take all complaints. That goes back to use of force. My analogy there, we have high standards here. We're going to take the complaint and investigate every one of them. And Craig, if you would just, the concepts, a lot of stuff that we come up with, either we originate out of the police department, from the line level officer or through the administrative staff, or we're not opposed to stealing ideas from other parts of the country. And I think Craig, I don't know where you learned the educational-based discipline program from, but if you want to speak to that real quick.
Yeah, so as watching the disciplinary process in the past, it was, they'd go in front of the director would hand out the discipline, whether it's a written reprimand, day off, a couple of days, multiple days off, however it was. And then the officer would just go back to patrolling and continue on. The flaw in that system is that, sometimes some of these disciplines would require some education to try to make sure that behavior is not repeated, because we did have some repeat offenders. And a lot of times there wasn't any intervention to try to help that officer become a better officer and serve this community to the best of their abilities. So employing a educational based discipline based on the offense and what we saw as a need. And a lot of times it's normally consultation with our police legal advisor to try to educate them in certain areas of liability and other areas that may have led to or were seen to be a deficiency that may have led to that discipline. So really trying to help the officer become the best officer they can to serve this community.
Thanks, Craig. I don't know if there's any questions from the board. I know we exhausted you for a couple hours, and I appreciate your patience with this. The ideas, the license to help, to quote one of our lieutenants, sometimes it's like turning a tugboat in a little small stream. And it's what we do sometimes, and we confront different issues that go on in law enforcement, but we do look for your support, number one, but number two is just ideas how to service this community. You represent the citizens, and we serve them. And please let us know what we can do to better serve this township.
Go ahead, Kate.
Thanks. I was just wondering, for the complaints that were founded, did you find any patterns?
No specific patterns that they came up during issues, because we had, once one's founded, we address them right away. I guess, driving tends to be a current pattern that we address. Speeds, maybe it's a lot to do with the predisposition of the administration too. So we're real attentive to what we've seen as we came up through the organization, and we're trying to address those issues, because it's not that we're the traffic police as administrators, but it's important to save lives, and getting to the scene is more important to how fast you get to the scene. It's one trend that we do see in law enforcement, and it goes throughout the state and probably the country too. But just because you're a police doesn't mean you can drive incredibly fast. And you've probably seen it yourself as a citizen. Sometimes the speed seems to be a little excessive.
And as far as your question about the pattern, again, we have a lot of oversight. We hold our officers to a high standard. We make sure that our lieutenants or sergeants are holding our officers accountable. And if we do see, again, two similar incidences, maybe a pattern to us, so we're going to make sure that we take the appropriate action to get that taken care of as quick as possible, depending on what the situation is and how we can handle it. So we do our best to continue to do oversight and make sure that the officers are performing in the manner that we expect.
In an extraordinary situation too, the progressive disciplinary process, it aggravates every time if someone doesn't resolve that issue. But very rarely have we seen that problem not be resolved within the first couple times in this office or at the counseling sessions on the street with their command staff.
Thank you.
I have a question.
Sure, go ahead.
I was just wondering, since it's a very diverse community, have you come across situations where the complaints sometimes are due to, just trying to say, understanding the person committing the offense, and like, you know, you, in your encounter, it is some sort of a due to a cultural difference, there was a misunderstanding and things like that. How often does that happen?
It happens that personal experience on that. It happens a lot with traffic offenses. It's been a while since I actually wrote a traffic citation, but from my experience, that happens a lot with traffic citations. I haven't heard that come up, maybe in the, 25 years ago, sometimes in a family violence situation. There's some differences how matters are handled maybe in their home country as opposed to how we handle domestic violence issues. I don't know if there's another way to answer that question, but Craig, anything coming to mind?
Like, have you seen anything recently? You talked about things happening years ago, but in the recent data, has there been anything like that? I just want to understand if there is some sort of things that can be mitigated.
I can't think of anything recent. I mean, we have had issues in the past,
Okay.
not a lot. However, as an organization, we continue to make sure our officers are trained in cultural diversity and things of that nature. So they do have an understanding. Again, will there be mistakes made? Absolutely. But we ensure that officers have as much training as we can in order to make sure that we avoid those types of situations the best we can.
Okay, thank you.
One of the items that maybe you hit on is dietary needs for maybe someone that has to stay with us overnight in a jail cell. We'll accommodate that and directly buy what their dietary needs are, whether it's religious based or otherwise. So those things do come up, and our staff are well prepared to take care of that with our finances.
Anyone else? Okay, thanks, Chad.
Thank you. Thanks to the board for this opportunity. It's good.
Anyone else want to make any comments, or let me pull up the.
I'll just make a quick comment. Thank you very much to Chad and his team at the police department for leading by being transparent and being proactive in a lot of these issues. I always appreciate that and appreciate these presentations and making this data public.
Yeah, well, thank you. We have a lot of work to do, I think, when making this a little bit more timely and readily available for everyone. Our excuse is, as I started off today, is the RMS system needs to be improved. I envision an overlay, some type of program that overlays, but it doesn't exist to date that we're comfortable with. There's some companies that are budding right now that have a relationship with our RMS system, so that may be an option in the future, but we want to make sure that the data is accurate before we start jumping in that arena. We will start pushing out data publicly and quarterly. We'll also have our policies out very soon. We have a special assignment that's going to be filled pretty soon with a police sergeant. That part of their job is going to be addressing these data and policies that make everything public as soon as possible.
Any other comments? Okay, great. Thank you very much for all your hard work. I really appreciate everybody's presentation, as well as to our guests today. Thank you for coming.
Thank you, everyone.
Thank you, everyone.
Okay, do we have any, let me see, public comment? Don't say, I see Cheryl there. No comments from there, no comments from the public. All right, any other announcements, anything happening in the next couple of weeks, or anything we should be looking for other than some of the information from IOSHA or CDC, MDHSS? Anyone else? Okay, great. Well, thank you for the good meeting, everybody.
Thank you.
Do I have a motion to adjourn?
Second.
Thanks. Clerk Segers, can you please take roll call?
Borninski.
Aye.
Again, Foster.
Aye.
Pinguli.
Aye.
Graham Hudek,
Aye.
Seagrass, aye. Slavens,
Aye.
Snyderman.
Aye.
Great. Thanks, everybody. Have a good night.